Actually, a question for some of the surgeons. There was a comment last night about BMI limits and restricting who we operate on for a variety of reasons. Either it's based on the facilities or just comfort level. I was wondering if I could go down the row and kind of ask if you have any BMI limits, and if so, why? Dr. Wright?
I do have a BMI limit of 50, and it is about both the physical limitations of my facility, as well as there's very many studies showing that there's a lot of secondary lymphedema. About 80% at a BMI of 50 have secondary lymphedema. And even at 60, it's like 90%. And it really does affect the healing, and so those are the two reasons I have a BMI limit. We counsel and do weight loss in management before to help people get to that.
Well, I'm doing my best before surgery during the 3 or 6 months as I prepare patients for surgery. I'm trying to decongest them. As Tom says, a lot of the BMI is fluid, and a lot can be reduced by optimizing decongestion. When we reach a plateau, I think I do not have a limit on the BMI, and I feel sometimes, it might sound paradoxical, but sometimes some people I saw in Germany, there's a certain limit. I mean, below 35 or 40, they will not touch. To me, sometimes you have to operate because the BMI is high. Not despite, but because patients are so immobilized and they cannot lose weight unless you enable to walk and improve the mobility. So sometimes you are forced to do it in the high BMI.
So I agree. Excellent explanation and answer. In our facility, is this on? Okay, great. Sorry, I can't hear myself. So in our facility, we care a lot about safety. So safety is number one. We do everything in an accredited surgical center, and we focus a lot on safety. And when it comes to BMI, we don't have a BMI limit because we don't want to isolate the patients who cannot bring down their BMI. There are a lot of patients who are a higher BMI, and we want to be all-inclusive for everybody. But we are very cautious when we treat our patients because we do a very thorough medical evaluation. We have to get good clearance from their primary care cardiologists going forward, but we don't use the BMI as a restrictive factor.
Got it. So you don't have an absolute BMI cutoff in your practice for the facilities?
Right.
Okay, got it. All right. And a question for Hiba.
Yes.
Insurance?
Do I have it?
Did you go through it?
Nope.
No, okay, got
No.
it. All right, there's a question about how to just keep your head above water when you're dealing with insurance companies.
Well, like anything, you just can't give up, right? So once you start down that path, you just know that you can't let up. And it's very frustrating working with the insurances, and it's very easy to want to give up because they make you absolutely out of your mind. But ultimately, you need to clear every roadblock, and they're a roadblock. And if you just approach it as this is just one more step before surgery and focus on just clearing that roadblock one small step at a time, that's the only way to do it. And then while you're going through that, make sure that you have a good friend that you can call and randomly and just say, I need to vent, and then go off on just the most unhinged rant for a good 15 minutes while she listens quietly.
All right, well, thank you very much to our panelists for this session. Switch it up.